Hi everyone, I'm Dr. Z. I'm a clinical psychologist specializing in transgender care. Welcome to my channel. Today, I would like to answer a comment that one of you posted that I thought was very, very important to talk about. And I also thought that this comment is going to be especially relevant to a lot of you who are younger adults. I see this being less of an issue in regards to this comment for people who are older adults, but I definitely see this question pop up with people who are younger adults, and I can totally understand why. So here's the comment. I blacked out this person for privacy reasons. Here's the comment that this person asked me on this channel. I'm going to read it. I have mild physical dysphoria that affects my everyday life. Very common for a lot of you, by the way, to have mild, from mild to severe to almost feeling like non-existent dysphoria. But I don't know how much dysphoria is enough for me to justify medically transitioning. How can one know if they have enough dysphoria to justify medically transitioning? So, in other words, how do you know at what point to gauge to decide whether medical transition, in this case, medically, we would assume it would be hormone treatment or surgical treatment, in order to really justify that hormones and surgeries are warranted? Very, very tough question. I'm going to tell you right from the get-go. It's not really a matter of gouging whether your dysphoria is severe enough. There is really no barometer, for example, that tells you and us clinicians and anybody else for that matter, where necessarily a surgery or hormones become warranted. So, for example, it's not analogous to when you go to a doctor and they say, "What is your pain level on a scale 1 to 10?" And you say, "Oh my God, it is 10. It's killing me." And then they decide how strong of a pain medication they need to provide in order to help you with that pain. If you tell them that your pain is probably 3 or 4, they will give you non-narcotic, most likely, I would assume, pain medication to combat that. When it comes to dysphoria, it doesn't really quite work like that. It's not a matter of, hey, on a scale of 1 to 10, how severe is your dysphoria? And for this individual, you're describing it as a mild physical dysphoria. So I would assume perhaps maybe 4 or 5. There's no really set of scales that correspond to when the treatment, transition-related treatment interventions are warranted. And that's where it becomes really tricky. And I can see for a lot of younger adults, it becomes really difficult. The reason why for younger adults it is especially difficult is because you have shorter periods of time that you have lived your life. You as young adults, again, I don't work with minors, so I would say age 18 to probably about age 26 or 28, I would consider those individuals to be young adults. Because you're young adults, you only lived X amount of years. And even within that scope of years lived, you only had X amount of life experiences, right? So think about you really start settling into your sense of autonomy when you're probably going through puberty, your sense of agency during that age. But it's really not about until you're 18 years old, at least in the United States, that you're able to make much bigger, broader decisions for yourself. And actually, that's when you're able to make decisions for yourself apart from parents. So adulthood really starts around that age period and continues into your life. And because you have lesser experiences, most likely you have also lesser relationships and just overall lesser scenarios that you were involved in that help you or put you in a position to make difficult decisions. That's why it makes it that much more difficult. For people who are older adults, they've been living with gender dysphoria for majority of their life, or they just became aware of their gender dysphoria later in life, regardless, because they are older adults and they have lived a lot of different experiences. They're better yet at making those decisions. But this is why I say for younger adults, it's that much more difficult, especially if you're still not sure if transition is for you. You're going to be wondering at what point can you justify, at what point your dysphoria becomes justifiable, like this person is wondering, toward medical and surgical transition. Here's what I think as somebody who specializes in this field. If you already thinking at what point is, for example, hormones are even justifiable, that's maybe something is nagging at you. I would say that's an opportunity to maybe explore that more, visit gender therapist in your area if you can find one. But that's usually an indication that you don't yet yourself perhaps feel certain element of certainty about your own identity, or perhaps you do feel an element of certainty, but you may be afraid. There could be subconscious even fears of you regretting stepping into transition. In any case, if something is nagging at you and making you wonder whether your level of dysphoria is justifiable or justifying, in this case, medical transition, I would say explore that more. Time is something that you have in your sight, in a sense that it is there and it is there to be utilized. A lot of people, they start hormones because the dysphoria is just at a point where there's no other steps but to start taking hormones. It is that severe, is that painful. For the rest of the individuals, they step into the hormones because they really feel like it's very much in alignment with their transition goals, with their transition roadmap, with where they really want to go, with their trajectory towards their desired gender. And the reason why they don't even need the justification of the severity of pain of dysphoria is because they're very certain toward which gender identity and presentation they're moving forward. And that's why for a lot of people, they may even have very slight dysphoria and still move toward hormones because they're not looking at dysphoria to justify stepping into hormones. They're looking at their overall sense of identity and how much incongruency they're already feeling with their gender assigned at birth, and how much overall sense of congruency they already perceive feeling toward their authentic gender. But for individuals who, again, looking for that severity in order to gauge it, I would say this is a time to really just explore a little bit more. Again, in no way is my suggestion to explore an attempt to gatekeep you. As adults, you have your own self-agency, you have your own self-advocacy. A lot of United States are practicing informed consent model. You're welcome to go and get access to the treatment and access to hormones. My job as a psychologist to help you psychologically understand why there might be a nagging feeling inside of you, looking for that justification of dysphoria in order to justify moving forward. For some people, again, dysphoria is so severe enough that there's just absolutely no way out. And for a lot of other individuals, it's because they feel that sense of certainty. But unfortunately, we just don't have a particular scale of dysphoria. Of course, as clinicians, for me, for example, I worked in this field for so long, and I work with so many individuals of different varying degrees of dysphoria, including not only physical dysphoria, but social dysphoria, that I'm very accustomed to gauge for myself and to assess whether the person's dysphoria is severe enough. Sometimes, unfortunately, what happens for a lot of you is that you don't even recognize how severe your dysphoria is until somebody puts it in a context or presents it in a words, in a language that suddenly makes you realize, oh, yes, I engage in this behavior, and I can't believe this is an indication of how severe my dysphoria is. Similar to the videos that I did describing severity of dysphoria, where a lot of you wrote that you didn't realize how severe your dysphoria was until you realized that you also can't look at yourself in a mirror at all. And I mentioned that that's an indication of severe dysphoria, because not even being able to confront yourself in a mirror, that's a good indicator of severity. So sometimes working with a professional can help you open up and understand things about yourself, because professionals who work in the field are able to put it in a language, put it in a context that creates that type of understanding for you. But again, unfortunately, there is no gauging scale, and anybody who is watching this who stepped into medical and surgical interventions would probably say that wasn't really a matter of waiting for severity of dysphoria to justify what they're doing. It was just, you know what, the pain in of itself was enough to justify the sufferings, the everyday struggle, everyday pain of dealing and living with gender dysphoria for a lot of you is enough. So again, I keep saying again, because some of the things is not black and white. So a lot of these decisions that come to transition and deciding what's best for you is not going to fall into very concrete, very clear black and white. There's a lot of gray in between, especially the older you are as adult. There's going to be a lot of gray for you, because again, you accumulated your life, you accumulated those experiences, and the younger you are, a lot of gray for you is going to be a lack of those experiences. So lack of also understanding yourself as well. well. Comment below, let me know what you think. How did you justify for yourself? Maybe some people commenting can help this individual gain some insight. How did you decide for yourself at what point it felt right to move forward with medical or surgical transition? I love reading all of your comments, and I will see you all next time. Bye.